Hey everybody, sorry, just practicing. Dr. Vince Gutierrez here, physical therapist. You can find me at movementthinker.org. I was not twerking, okay? I was warming up for the next move that we're going to cover. Some people have trouble disassociating their pelvis from the rest of their body, right? They try to move their pelvis back and their trunk goes far forward. They try to squeeze their butts and they just lean backwards, right? They can't disassociate their pelvis from their body. That's part of the song, right? No, it doesn't matter. Anyway, so one of the exercises that I cover for these patients that have trouble moving, just globally, they just have trouble moving. When you watch them move, it's like you're watching a canoe, right? It's just the whole thing tips forward and the whole thing tips backwards. There's like no movement through the spine, period. Let's start. It's safe to move your spine. There's a lot of therapists out there that say this is dangerous. Okay, that's not dangerous. Let's start there. Your body was meant to move, right, and move in a bunch of different planes, and you have to learn how to move it first. Don't get me wrong. You have to understand how to control motion, but movement in and of itself is not dangerous. The lack of movement, meaning sitting down, laying down 24/7, is probably more dangerous than moving itself, right? Because we know the negative repercussions that come along with not moving: high blood pressure, risk of stroke, diabetes, obesity. We all know the risks of not moving. I would much rather have the risk of moving, right? Because that's maybe a little muscle soreness, some pain, a little bit, but it's much better than the risk of not moving. And again, not all pain is bad, so let's start there. Didn't realize I was going into this before I jumped into the exercise. Not all pain is bad. Some discomfort or pain is actually expected when you do a new exercise. So don't freak out. Make sure that you see somebody who's qualified to treat pain, or you can do some quick searches on pain. You can look at movementthinker.org to discuss pain. You can go Google Jared Hall. Jared Hall is putting a lot of stuff out there on pain. Jared, shout out to Jared. But yeah, educate yourself on good pain versus bad pain, and if you don't know the difference, go see somebody who does. I do. That's fine. You can come see me. But we're going to look at a different movement to talk about disassociating. In yoga, this is called Cat-camel. I don't care what you call it. You want to call it twerking? Fine. The name of the motion is not as important as the motion itself. This goes all the way back to Shakespeare, right? A rose by any other name is still a rose. Okay, so you would go down on your hands and knees. The goal for this motion is to get pelvic motion, so to be able to move your pelvis back and forth. Your pelvis should move. There's nothing wrong with moving your pelvis. And to get thoracic extension and flexion. Okay? And so you move your pelvis backwards, get some thoracic extension. You can actually look up from this position as long as it doesn't increase any more discomfort more than a couple of points. You can look down, flex the thoracic spine, and roll the pelvis. There's a certain population that shouldn't do this exercise. If you have osteoporosis, see somebody who's qualified to treat osteoporosis, I am, before you start initiating some exercise programs like this, because it may increase your risk of injuring yourself if you go through flexion-based movements, forward-bending movements. There's very few populations that we recommend that they don't necessarily flex. Osteoporosis is one of those populations. So again, it's pelvis back, head up, chest up, and drop your belly down between your knees and your hands. And then raise your belly, raise your chest, and tuck your pelvis, almost like a dog tucking its tail between its legs. And bring your chin down to your chest. Up and down. The goal is to just create more movement than was there previously and teach you how to move. Live better, move better, live well, move well. Thanks for watching.